And with a third COVID vaccine on the horizon, doctors are hopeful it'll boost vaccine distribution and immunity.
And while the Johnson & Johnson vaccine is said to be just 72% effective in protecting against moderate to severe COVID infection, doctors say any protection is important.
I get where people are like, well, I'll wait around for the Pfizer or Moderna.
Dr. Andrew Jameson, the division chief of infectious disease at Mercy Health, knows that COVID vaccine data is confusing, especially when trying to understand efficacy rates.
It is very hard for the general public to interpret data when the endpoints are different. So the Johnson & Johnson used moderate to severe COVID-19 as an endpoint, and Pfizer and Moderna used just getting diagnosed with COVID-19 with symptoms as an endpoint.
Both Pfizer and Moderna's shots boast about 95% effectiveness in protecting against COVID-19. Johnson & Johnson just 72%. But Dr. Jameson says that is still enough to keep severe illness at bay if you do happen to get sick.
If we could give you something that would pretty much guarantee you're not going to be hospitalized and won't die from COVID, would you do that?
And he says keeping people out of the hospital is key to beating the virus.
The times when we see overall death numbers go up from COVID is when hospital systems get overwhelmed.
With more vaccines in circulation, Dr. Jameson is confident the Johnson & Johnson one-shot system will be a big plus to certain groups.
There are some downsides to it in terms of that overall viral efficacy, but I think that if we're talking about a simple one-shot, easy way to give you good protection from death, that is not a bad place to be.
Johnson & Johnson has submitted the request for emergency use authorization to the FDA, and we could see a decision on that by the end of this month.